This is Average Joe PT, where we're here to reduce pain, reduce anxiety, and improve overall function. Now today, Scully and I, you know it, Scully and I, we're gonna go over SI joint pain and hip pain. I've scoured the internet and really all I see is some stretching and strengthening exercises, and I'm sure that's not gonna fix it. I've been doing this forever, and you need to do these other techniques that we're gonna go over today. They are manual mobilizations, manual techniques, positioning techniques, and the stretching and strengthening. You need to do all four things combined to reduce your overall SI joint pain. Now, it's all encompassing. It's gonna take a little bit. You gotta go through the whole thing because you need to do all four things to reduce that overall SI joint pain. You just stick with Scully and I. Here we go. Alright, we're going to do a real quick and skinny anatomy lesson. Just stick with me. It's just a few minutes so you understand what's going on here. So we're talking about the spine here. And so the lower part of the spine, you have the sacrum and you have the pelvis, or what we also call the ilium. When you come at the last level, the L5, that lumbar spine, fifth vertebrae, you come right in the sacrum, or S1. So with the SI, sacrum, S, ilium or pelvis, in this case we're going to use the fancy word ilium. That's the reason why it's called the SI joint. It's that joint right there. Now when you do any prolonged sitting, you're stressing that joint because as you flex forwards, that sacrum moves in the opposite direction. So as your head comes forwards, your sacrum and tailbone coming in the opposite direction. That's called nutation and counter-nutation. So without those fancy terms, because this is Average Joe, and that thing can get really inflamed and irritated. Ain't that right there, Scully?
I'm sure glad I don't have an SI.
Yeah, I know. He's glad he hasn't got one either. So anyways, this is the basics of the SI joint. And the reason why we're doing the massage is because when this thing gets jammed up with the piriformis or the glute muscles, I'm going to give you a pic right there and you can see where they're sitting at. You want to do either the foam roll, the deep tennis ball roll to really try and get that stuff to loosen up, and then do the mobilizations that I'm going to show you, and then the stretching and strengthening. So as you can see, you need the combination of four to help reduce and fix this SI joint problem and hip problem. So let's go ahead and get started. So technique number one, treatment, massage. First thing you want to do, either you're going to get a nice foam roll that you can easily pick up at the dollar store for probably a few dollars. All right, and let's just say that we're looking at the pelvis and we're saying it's the right side SI joint. Go ahead and just zoom that in real close real quick. Let's just say that it's this joint right here, that SI joint that I talked about earlier. What you want to do is just take that nice foam roll. You're going to be easy on this. Remember, you have that sciatic notch right there. You don't want to press down into that where the sciatic nerve is. We just want to work on those muscles on that one side. So if we just come off nice and easy and gently just roll over onto it a little bit. You might even want to get down into the hamstrings a little bit because they come and attach up at the butt area. So come right on down through onto that side. You're going to roll it nice and easy. Don't put all your weight down onto it. Kind of lean off of it a little bit. And just kind of rolling back and forth. And you're going to do this for about 30 seconds to a minute. And then you're going to come off of it. And then relax and repeat. And I like to do this for about 5 minutes. It goes by very quickly. Just roll nice and easy over onto it. Now the second one is a good old tennis ball. And you're going to do the exact same thing. Sit directly on that, okay? Come off nice and easy. You're going to show you a nice side view of it. Kind of rolling around that SI joint where those muscles really get it irritated, attached to. Maybe hold that little spot off the side. Make sure, like I said, don't be pushing right on that sciatic notch, right where that sciatic nerve comes through. That wouldn't be a good idea. So you're just going to easily just roll over onto it. Same thing as you would with the foam roll. 30 seconds to a minute, and then go ahead and relax and repeat that for about 5 minutes. If you ain't got a foam roll, just get yourself a tennis ball. You ain't that right. Come on now, say something nice.
This stuff better work with all that time everybody's putting into this.
Scully never wants to say anything nice. We're gonna have to reprogram him at some point. All right, so that's number one. Number two, self-mobilizations. That's right. You can mobilize your SI joint in your pelvis all by yourself. It's pretty easy. There's 2 different techniques you can do this. One of them is called the shotgun method. You're just gonna lie down on your back, and what I want you to do is really squeeze your knees together really tight. All right, and then go ahead and put your fists in between, and then squeeze really tight, and then relax. You might even get a little bit of a pop in your hip or your pubic area. And that pubic area is what I'm talking about. You can get a pop in that area. That's a cartilage that can easily pop all the time. Shouldn't be painful at all. It'll take some of the pressure off of that SI joint. You push on the sides, and then squeeze, hold for maybe 5-10 seconds, then push on the sides again, and you want to do that for maybe 5 to 10 seconds, and then relax. Once you get that pop, you're done. That's it for that one. Now, second technique for self-mobilization, be on your back, and if it's the right side like we've been talking about that's hurting, you're going to do is bring that knee up towards your chest, take your hand to the knee, and push against. As you're forcing your knee to come towards your hand is putting equal pressure onto the knee. You're gonna hold that for about 5 seconds, then come down, relax, and then you can rinse and repeat. Sometimes if it's not hurting too bad, you can straighten out the other leg while you do this. And you're gonna do this for probably 10 times, holding that resistance for 3 to 5 seconds, then relaxing. Now if it's hurting too much, with your legs out extended, just do it with the opposite leg bent and do the same thing. It's not as effective, but it's always better than nothing. So that's the second self-mobilization that you don't hear about anywhere. Ain't that right, Scully?
That's how we do it, average Joe style around here.
Yeah, see? All these tips you're just getting on average Joe. Treatment technique number 3. These are what you see all over the internet. Just don't be too aggressive with them. Always hold 30 seconds to a minute. And that is, if we're talking about the right side, the piriformis stretch. Now in this position, you're actually supporting the spine. This knee goes to the opposite shoulder, holding for 30 seconds to a minute. Don't try and do the figure 4 method where you're pulling the opposite. A lot of times that can irritate your lower back. Just come in that direction. You're gonna get a nice pull through those hip muscles, those rotator muscles, that piriformis muscle that comes down through. Now I'm gonna leave a card up here. I talked about this piriformis probably 2 or 3 weeks ago. It's in my lower back pelvis group, and so you can go ahead and look through that. It's on it's on the playlist. I'm gonna put it right there. If you look through that, go ahead, it goes over through the piriformis, where it's located, and what you can do to help reduce your piriformis syndrome. So that's a nice one to look at. The next stretch you can do is pretty simple. You'll be in the same position, and all I want you to do is just gently push your knee away from you. Now, when you do this, you don't want your lower back to turn and rotate. Your back stays flat on the mat or the floor, and you're pushing your knee away from you. You should feel a pull, maybe in your hip a little bit. Pull for 30 seconds to a minute and relax. Don't be pushing to the point where you get a lot of twist. You should not twist at all on this one. And you want to do maybe 2 or 3 of those. So that's 2 nice stretches you can do. Now you can go ahead and do the hip flexor or iliopsoas stretch if you want to. Just be mindful when you're in this position that you're getting a nice, I'm going to show you on the left side so you can actually see it. So you get a nice pull. Don't tilt forwards, just hold like this. Same thing, 30 seconds to a minute, and then relax and repeat 2 or 3 times at the most. Now let's do a couple strengthening exercises, the ones I've shown in the past. I'll show you, say it's your left side that's giving you pain. You're gonna lie inside, feet together, open, pause. I always talk about putting your hands on your hips so you don't rotate back. You keep the back and the butt muscles and the abdominals engaged as you open and close. Come up, pause, and then close. Come up, pause, and close. You do that until you feel nice fatigue in there. You might get 20 or 30 of those. The second one, extend your legs out, rotate in, hand on your hip, same thing. Then up, pause, and then back down. This is a nice glute exercise. Come up, pause, and then back down. Now if it hurts, do it with it bent. Up, pause, and then back down. And when it doesn't hurt so much anymore, you can go ahead and extend that leg back out. All right, so it's a nice progression. And you're doing this till you feel a nice little fatigue or burning sensation. So you don't worry about them coming up, holding for 2 seconds, and just repeat until it feels fatiguing on that side. So that's 2 stretching and 2 strengthening exercises you can do for this SI joint problem. Now, you can always do heat before, heat up for a good 5 to 10 minutes, and then you're gonna wanna ice afterwards, especially if the thing is really inflamed. It shouldn't with these, unless it's really aggravating. So, we got the stretching, we got the strengthening, we got the self-mobilizations, we got the massage technique, we got the posture one, don't we? He doesn't tell me nothing. He keeps quiet unless he wants to say something snarky at me. Positioning. Positioning is the final one. Now with positioning, you want to lie on your side, put 1 or 2 pillows between the knees. I tell people to do, try and find a wall or the back of a couch or something like that so you can sit back and support your back and your hip while you have a pillow between your knees. And you always want to do ice, especially if you're getting radiating symptoms down your leg, always want to ice it. So that's a nice positioning exercise. Now you can always do the one where you're lying on your back with your legs over the pillow. I'm going to leave a little card up here. I went over that in one of my other videos in great detail. With Scully and I, those are 4 main exercises and techniques that you can do at home to reduce your overall pain. Stay tuned. Alright, that's everything that you can do at home for your SI joint pain. Scully and I would love to have you subscribe and become part of our community. If you have any comments, leave them down below. Maybe I'll talk about the next topic. What do you think, Scully? What do you think our next topic should be?
We're gonna do some leg swelling treatments next time.
Okay. Alright, until next time, I want you to look up and keep smiling. Ain't that right, Scully?
That's right.
Yeah. He's getting it. See you next time.